All right, for those of you who were here last time, you may remember that I was up here for about an hour and a half talking about a bunch of charts and graphs showing how bad our healthcare system was. I won't bore you with that tonight. I actually kind of get right straight to the point of what citizen health is. And I have a few questions for you before I get there, kind of get your interest going. And what is health to you? You actually think about health. It's not just physical health. It is you got emotional health, you got your mental health, you got your financial health. There's a lot of aspects to health that you really take for granted until your health is gone. When your health is gone, you're dead. You can't do too much about that. So thinking about other terms of how important is your health to you, and also how valuable is your health. And if somebody holds a gun to your head, your health is pretty valuable. And likewise, the economic output of your health, if you think about our economy and just the economy of the world in general, depending on our health, well, the output of our economic output is actually based on the health of the workforce. Because without healthy employees, that particular corporation or that employer is not going to be as productive, because you're not going to produce as much, you won't be going to work as much if you're sick. So health is very valuable in terms of just economic output. And as a matter of fact, Winston Churchill said that healthy citizens are a country's most valuable asset. And we are exploiting the heck out of our health right now. And these are the only two charts I'm going to show, I promise you that. But if you look at this actually shows life expectancy. That doesn't pick up. It doesn't pick up. But you got life expectancy. This is the age over the price per head per capita. And you got the United States. You see we're just off the track here. And you got all your other countries, all your other developed countries. Now you got about 206 countries, so it's not all of them. But majority of them, they're hovering around about 82 years of age for life expectancy, costing about $3,000 a person. Now this is actually a little outdated. We're actually at $10,000 per person right now. And for the first time in 20 years, we actually had a dip in life expectancy. So we're spending more, but we're dying off quicker. It's really not good. But if you look over here at your growth of physicians and administrators, if you can read that, the big yellow stuff is people that are needed to understand insurance and bill insurance. It's basically what those people are for. And if you see the small little red line at the bottom, that's actually the growth of physicians. And if you see that black line, that's actually the growth of the cost. So it kind of coincides with that. If you actually do the math over there, it's pretty much lines up. So you can clearly see really what causes us to spend so much money. And if you get down to it, it's way more than what you see on that graph. But
Brennan, I'd be willing to bet that healthcare and banking look very similar in a chart like that. And the tie would be government regulation.
Yep, it's regulation. And that just filters down to the government regulation. You have all your companies are also regulated, so they kind of set their own regulations for people working up underneath them. And it's straight up government regulation. And if y'all have any questions, just feel free to stop and ask me during this. It's no big deal. But Peter Thiel, in his book 0 to 1, he actually had a section there talking about secrets. And the idea behind big successful companies is they always have a secret. And I found a secret over my past couple of years of research, and it is the American citizens are the largest single payer of healthcare. And people think that the government is the largest single payer. Well, they don't necessarily pay for anything. We pay them. They don't generate money. Federal Reserve generates money. And we pay these guys to basically act as an intermediary. Medicare, Medicaid, the VA, Indian Health Services. So if you look at the math and you actually calculate out how much the American people pay, which I've never seen anybody do this study, and it took me a while to figure this out, but we actually pay altogether a collective $2.3 trillion. And I'm going to break that down. Now, the people that are under an employer-based plan, that's about 150 million Americans are under an employer-based plan. We pay in premiums, along with our employers, we pay in premiums a total of $1.2 trillion a year, just in premiums. That's just for a promise by the health insurance companies. It's not counting out of pocket, not counting copays, not counting pharmaceutical costs. If you tack on all of that, and then you tack on the $800 billion that's withheld out of our paychecks every pay period, it comes up to be $2.3 trillion. And that's how much we actually fund the whole healthcare system. And to make it even worse, I started looking at these publicly traded health insurance companies. And they're publicly traded, so you can actually see who owns them. If you look at the institutional ownership, on average, about 90% of every publicly traded company is owned by mutual funds and hedge funds. And whose money do they play with? It's our money. So you start looking at it, we, the American people, not only do we fund the whole operation, we essentially own the whole operation. And yet we're letting these for-profit corporations run all over us, dictate what happens, and we really have no say-so in this. Just the way it's set up, and it's set up by design. So the whole idea behind citizen health is to give power back to the people. And I'll get to that a little bit later. But 1 trillion, now that number comes from a few different sources. I actually took a while to do this, but if you look at every single healthcare professional, every single doctor, you got about 900,000 active physicians right now. Anywhere from your family practitioner to your cardiologist, neurosurgeon, everybody that you consider a physician. You count every single nurse, every nurse practitioner, every physician's assistant, every chiropractor, dentist, every single health professional. You take their average salaries and you add that up. Now I know it's average, some people work more or less, but just take their average, add all that up and it equals to $583 billion. That's to pay for everybody that's in healthcare. Not counting, people that mop the floor or the people that actually work in administration, which you saw clearly, that's really the problem. But if you just add up all those guys, 583 billion, let's just give them all 20% raise, round it up to 700 billion. So we got 700 billion to basically pay these guys to do all this. And then for the hospitals, your clinics, all their operating expenses in terms of keeping the lights on, water, all your medical equipment they have to buy, your expensive MRI machines, that's about another $250 billion. So let's just round it off to $1 trillion to really fund, keep everything going. We can clearly see, we spend 2.3 trillion, it only costs 1 trillion to make it happen. So there's people in the middle that take a lot of money out of this equation. And that is mainly the insurance companies. A lot of insurance companies, they try to justify it by saying, well, our margins are small, we only have 2 to 3% margins. Well, yeah, I'll take 2% margin on a $200 billion revenue stream too. I mean, just you start seeing stuff like this and you realize that one of the big problems are the middlemen, the intermediaries, and they're just weighing the whole system down and causing all the problems. So I've come up with a plan to really eliminate those middlemen there. So let's move on. How we're fixing healthcare. Now, I'll talk a little while on this, but how we're fixing healthcare. Excuse me, grab this water back here. You see there, we're essentially crowdsourcing and crowdfunding an entirely new health ecosystem using exponential technology such as AI, genomics, and newer technologies like blockchain technology. And you see that it's powered by the Meadow. This is our new cryptocurrency. And we did a show of hands. Who's heard of Bitcoin? I'm sure everybody's heard of Bitcoin. Pretty much everybody. Well, there's a lot more cryptocurrencies out there. We've got probably over 3,000 different cryptocurrencies right now. Half of those aren't worth anything. I created a Hodge coin the other day just to do it. So there's cryptocurrencies out there. But the market cap right now, I didn't look at it today, but I mean, it's been fluctuating between 100 billion to 130 billion for the past few weeks. That's really a speck in our global financial system. So there's got a lot of room to grow. Matter of fact, I saw a stat today, it was 0.3 or 0.03% of people actually own cryptocurrency right now. It's global. There's got a lot of room to grow. So before I kind of move on to the actual ecosystem that I plan on developing over here on the right side, I have a few things to explain, some of these concepts to put in perspective. And one is blockchain technology. And let me see, blockchain technology, everybody has a different description for it. Different use case. It's vast, but I like to break it down in simple terms and not necessarily how it works, because I'm willing to bet not too many people know exactly how the internet works, but we use it every single day. Mm-hmm. So in terms of blockchain, or in terms of the internet, you think about a network of data. You can transmit data to and from, you have protocols set up to do that. Well, you can't transact value in the same way. So now they have this technology called blockchain that allows you to transact value anonymously, pseudo-anonymously, in a transparent way. It's almost like a distributed ledger. A lot of people call it that. I don't necessarily like that term, but kind of blockchain kind of gets into many different use cases. And I like to think of it as being able to digitize assets and tokenize assets and being able to trade those assets without anybody's permission. And I'll give you a story on really what clicked on me. I was sending some money to a developer in Romania, and it was about $2,000 or so. And I went to the bank, and I had this long printout of all this, the routing information, the bank's address, and a bunch of stuff I really didn't know because it was Romania, just complex stuff. So I drive to the bank all the way across town, and the people that were trying to wire this money didn't understand what this was. I mean, you see an address in Romania, you're thinking, what is that? Is it the routing number? What's going on here? So it took us about 45 minutes to finally figure that out. It would cost $35 for a transaction fee, for international wire fee, and that guy got his money 5 days later. And the whole time this is happening, I was sitting there thinking, I could have sat at my desk, I could have sent him this money using Bitcoin or any cryptocurrency, and he could have got it within minutes, and it would have been virtually free at the time, just a few cents actually for the transaction fee. So right then and there, I realized that, whoa, this is going to change the world. I mean, it's going to change financial systems, everything, because you can you can send money anywhere without anybody's permission. And that's a huge thing for the world. We don't have problems with that. As far as developed countries, we have access to banks, we have access to money financial systems. You got a lot of countries that people don't even have a bank account. So the cryptocurrencies and blockchains in these developing countries are really going to flourish quickly. It's going to have that leapfrog effect where you don't have banks, so you're just going to bypass that financial infrastructure altogether and just essentially pick up your phone and turn that into a bank. So kind of with context of that, let me kind of get into now the ecosystem and how all this comes together and fixes healthcare. So the incentive system is going to be our first product, our first release, and that is a system that pays you to be healthy, and it's going to pay you in our cryptocurrency. Based on certain metrics, if you hit these certain guidelines, if you say, for instance, with your Fitbit, this is how it's going to work. You're going to join Citizen Health, and you're going to have an option to connect your 23andMe data, your genetic data, your Fitbit data, your Apple Watch data, just any fitness wearable that you have. You'll be able to connect that data. And we're going to generate you a health score. And this is kind of similar to a credit score. Everybody has a financial score that a lot of things are based off of, but we don't have a health score. So if you can't measure it, you really can't improve it. So we're going to use some technologies and open source software called HGraph to actually do this. So right off the bat, you're going to have a health score. And it really doesn't matter what it is, it's going to be a baseline. And then throughout the day and the week and the rest of your life, as long as you're a member of Citizen Health, you can actually generate more Meadow by hitting certain metrics, by living a healthy life, by making healthy decisions. If you just hit 10,000 steps every day, you can generate more Meadow. If you run, you can generate more. If you go work out too, yeah, you're making more. So this incentive system is really a behavioral change system. I don't like to use that idea or that term because people say, I don't want to get somebody trying to change my behavior, but that's what we are trying to do. We're trying to change people's behavior from a poor, unhealthy behavior to a healthy lifestyle, and people want that. A lot of people, that is kind of the new in thing now, is to be healthy, and I think people are starting to realize that being healthy, it makes everything better, it makes their whole life better. So that incentive system is the first product we're going to have, and that is going to be one of the driving forces behind all this, because that's going to be the first initial way how people generate Meadow and the first initial onboarding process for Citizen Health.
Is it negative Meadow if you go down?
Or if you just go flat and you just don't do anything? Or is it just incentivized? If you do a good job, great. If not, you're still okay.
Yeah, I'm thinking about that. I'm also thinking about Steam, how they have multiple currencies.
Yeah.
So I'm thinking about both different ways. Nothing's etched in stone now. This is all kind of a theory. Still haven't developed anything, but this is the plan. But so what do you think about that? I like personally be penalized if I'm not doing good. That's incentive for me to get off my butt and do something.
Yeah, I feel like you could obviously, this is like a small, tiny percentage. You could also have people game the system of like, hey, you're going to sit on the couch all day, give it to your wife, she's going to the track to work out. But that's such a small, it's a random case. But obviously it could help with a lot more onboarding quickly, but obviously you said you're just getting into it, so I don't want to assume. Yeah.
I mean, this is wide open. The whole idea behind this is not just a handful of developers sitting in a room putting this together. It's going to be one large open source initiative, crowdsourced open source input from everybody. And that's the whole idea behind joining Citizen Health. You're actually going to have a voice in this. I mean, it's not just you sit back and you take whatever this corporation gives you. No, you actually sit down and you got to vote. You can sit there, and if you don't vote, we're probably going to email you and say, hey, we need you to vote. And you can actually have a discussion with the direction of Citizen Health, the pricing of things, and so forth. Just the whole discussion on the direction of Citizen Health. So, yeah, moving on. The collaboration engine. Collaboration engine is something that's really going to be big. Let me see. This taps the power of the crowd. Everybody is probably familiar with Uber, Airbnb, Top Coder, you're probably not familiar with them, InnoCentive. These companies tap the power of the crowd. They take a lot of people spread over a lot of different areas with a lot of different backgrounds and experiences, and utilizes their assets to create something really cool. And Airbnb, everybody knows what that is. But one thing that I really want to hit on is InnoCentive. Probably nobody's ever heard of that, but that's an open innovation platform. And that is a platform that takes or it offers solutions to companies such as Pfizer for one, or any hospital, just any corporation that has problems that they're trying to solve, but their internal team cannot solve. For instance, I'll give you an example. I believe it was Cleveland Clinic. They had this project, this competition, and they were trying to figure out how to make their algorithm better. It was an algorithm to detect heart abnormalities, and the efficiency of these algorithms really matters, because if it's a poor algorithm, it's really not going to detect them the way they want to. So they opened this up for thousands of people all across the world. InnoCentive has 300,000 scientists, engineers, developers, really smart people from all over the world that come together and solve these problems. Well, all these doctors, all these scientists, all these engineers, they could not come up with a better algorithm that was already in place. But two guys did solve it. And these two guys were hedge fund managers on Wall Street. And they actually went there and solved this heart detection algorithm. And that's just one instance where there's big problems that these siloed corporations have that their internal employees cannot solve, but they open it up and people from various backgrounds solve these problems. So you think that a doctor would solve this problem, or a software engineer would solve this problem, but no, I mean, it's just it's wide open for anybody to solve. And another example was for the BP oil spill. This oil field company was trying to figure out how to suck up the oil off the bottom of the ocean in a certain way. Well, no petroleum engineers could figure this out. And none of their internal employees could figure this out, so they actually opened it up on InnoCentive, and a construction worker that used to work with concrete in Minnesota actually solved it. So I mean, he was never in the realm of petroleum engineering, and yet he actually solved this problem, and they get rewarded. They get $20,000 for solving problems like this. When if you look at, say, whoever BP or whoever actually was doing this, that's been millions of dollars on labor just trying to figure this out internally. So it's open innovation. It actually just opens innovation to people with all kind of backgrounds and experience levels. Well, with this collaboration engine, it kind of takes the same concept. And what we plan to do here is solicit proposals from people all over the world to solve the biggest problems in science, technology, and medicine. And we're talking about curing cancer, curing diseases, curing diabetes, Alzheimer's, whatever that may be. These huge, previously unsolvable, or really people don't even try to solve them because the money is not there, the collaboration is not there. And the whole idea is to bring these questions, these problems, and let them filter up, and people will get to definitely vote on which one's more important. But then facilitate the organization of people from all over the world to come together to solve this. And just hearing that, whatever. But if you actually see it in work, in action, for instance, Top Coder InnoCentive, if you actually see that work, it's amazing. I mean, it's open innovation. It's really cool stuff. So that's the idea for our collaboration engine, is really to solve the previously unsolvable things in medicine and healthcare and technology. Pretty cool stuff. Now the health fund, you can think of this as a giant mega hedge fund. And this health fund will be funded with cryptocurrency, with the Meadow, and also hadn't even talked about it, but Citizen Health, it's going to replace health insurance with monthly memberships in replacement of premiums. So those monthly memberships will be converted into Meadow. So it's going to fund this huge health fund. And like I was saying earlier, that $2.3 trillion that we pay, or just keep it simple, the $1.2 trillion we pay in premiums, the whole idea is to direct those premium payments to these for-profit corporations to Citizen Health now, to this mega health fund that we use to pay out doctors, to pay out the patients who actually are incentivized to do healthy things, to anything else in the incentive system, to the collaboration guys that are trying to solve these problems. It's a fund just to fund things. And that's a pretty cool, neat concept. And then you move on to the community consensus. Now, with all this, you have to have people dictating what happens. That's where I was talking about people get a vote in the direction of the movement of Citizen Health. Well, the community consensus layer, governance layer, it's essentially what it is. You got the whole community, all the token holders on Citizen Health. They get to vote on the direction of everything we do. I mean, it's not closed off. Like I keep saying, open innovation and crowdsourcing, that's exactly what it is. This is owned by us. If you're a member of Citizen Health, you own it. You get a say-so in it. If you don't like it, raise an opinion. People join forces with you, then we can actually change it. And it's going to take a form of, it's not democratic governance, it's kind of a mix of democratic and holocratic governance. I don't know if anybody knows the holacracy, but Zappos and a few big tech companies are starting to experiment with that, and they always say, taking a big company and implementing that on top of it is kind of difficult, but starting fresh, that's when that holocratic method actually flourishes. So that's the concept. We're going to start fresh with that. And then you move on to the health and wellness marketplace. This is kind of one of the last things I came up with. And I'm sitting here thinking, we have patients or we have members of Citizen Health that want health services, they want products, they want health procedures done. And then you have physicians that are participating in this model. And I'm going to stop right here and kind of explain direct primary care. Has anybody heard of direct primary care? Not too many people. I mean, I went to a blockchain conference in DC about 3 or 4 months ago. Talked to about 20 people there. Not one single person knew about direct primary care. They heard about concierge medicine, but nobody about direct primary care, or just direct care in general. And that's essentially all these doctors get fed up with insurance. So they're not accepting patients with insurance. It's a subscription to healthcare for this particular physician. And it's mainly right now primary care doctors. So for instance, just like your Netflix subscription, you actually subscribe to your doctor and you pay them, say on average, $75 a month. And you can see this doctor as many times as you want to, or probably won't see him at all. You're still paying $75 a month. It's just a subscription to him. And a primary care doctor, they can cover about 85% of all the healthcare related problems. These guys are actually banding together to purchase bulk pharmaceuticals. So we're talking about like pennies on the dollar pharmaceutical drugs. And that's something not too many people are talking about. But I mean, sometimes you go and you buy a pharmaceutical and your copay is $20, but ask them, what is just the cash price for that? Sometimes that cash price is $3, but yet you're still paying $20 copay. It doesn't make sense. But these doctors now, it's growing. There's no definite number on how many doctors are out there practicing this, but it's growing. Just about doubling every single year. The actual direct primary care probably started about 6 or 7 years ago. And right now, I'm going to estimate there's about 10,000 doctors practicing this. There's only one in Hattiesburg that I know of. So it's definitely growing. Doctors are realizing that we can ditch insurance, save 40% on overhead because you can get rid of one person or two people that actually have to do the billing. And I can sit down here and I can use my own EMR. I can use whatever I want to because then you don't need the EMR because an EMR is basically for records to bill insurance companies with. And these doctors are absolutely loving it. They're getting to sit there and spend 30 to 45 minutes with each patient, actually get to know the patient. And as a patient, you can text the doctor, you can Skype the doctor, you can do whatever you want to because it doesn't fall under insurance regulation. And you got about 20 states now that have enacted some type of law saying that direct primary care does not fall under insurance regulation. So that opens the door for anything. Pretty much do anything you want to. And physicians are definitely jumping on the bandwagon, and there is one surgery center in Oklahoma that does this. It's straight up cash pricing. And they're very successful. And a lot of specialists are starting to figure this out that we don't need insurance. I can actually lower my prices and just offer a straight up cash price, or have a subscription, and my patients love it. And it's working out. Patients love it, employers love it, and the physicians love it. Only people who don't love it is the insurance companies. Who cares about that? So let me get back into the health and wellness marketplace. You can think about Amazon for healthcare in a way where you can shop for services and procedures. Because right now, say you need a knee surgery, a knee replacement or something. You're going to go see a doctor, and they're going to say, hey, you need to go see Dr. So-and-so. Okay, that's their buddy, or it's in network. You actually don't have any reputation on that doctor other than Health Grades or some random online website that kind of has a couple of reviews, mainly bad reviews, people get mad. But you don't actually have the health outcomes for this physician. So the whole idea of this health and wellness marketplace is to bring physicians to this and actually rate them. Actually rate them. If their outcomes are good, they can generate more Meadow. They'll be rewarded with more Meadow. If their outcomes are bad, they won't be rewarded with more Meadow, but their reputation score and their health score will actually go down. So you can pick doctors based on their outcomes and how good they are. Just like a baseball player. They got a batting average. Doctors don't have anything. They just do whatever they want to.
Will they be able to rate you as well? So it'll be
just like Uber.
Yeah.
And I love it because this is not just for physicians. This is a health and wellness marketplace. Anybody, any fitness trainer, anybody with acupuncturists, chiropractors, dentists, anybody that plays a part in making somebody healthy can join this health and wellness marketplace. And instantly they can be a part of the collaboration engine. They can also be incentivized through various means. It's kind of wide open. This is a whole new economy we're creating, so anything goes with this. And the health intelligence. Now this is big here. This will eventually take the place of EMRs. As I mentioned, when you remove health insurance out of the equation, now you're free to utilize technology to the fullest. So the idea behind this is when you have an interaction with your doctor, when you go see your doctor, that doctor will never touch a mouse, never touch a keyboard. Everybody's heard about Amazon's Alexa. Like a digital nurse or a digital assistant will be sitting there, always listening. It will be dictating everything you say. So everything that you and the doctor talk about, it's basically going to be documented. And running a health intelligence, an AI, a global AI that is trained by these physicians and trained by the data that the patients that are incentivized to put in, it's actually going to, it's going to analyze your genome, your microbiome, everything about you, all your data points, all your fitness and wearable health stats. We're going to analyze all that, and it's going to be projected on a big screen TV when you walk in there. So the doctor of the future, the doctor is not necessarily going to rely on his own intelligence, because think about it, there's 500,000 PubMed articles published every single year. That's the equivalent of a doctor reading one every single minute, just about, of the workday. There's no possible way a doctor can consume all the intelligence, all the knowledge that's happening every single day. So the idea is to utilize artificial intelligence to take the place of a doctor when he's not there. So I've been floating around the idea of having a doctor kind of train his own health intelligence to mimic himself, to kind of clone himself in a artificially intelligent way, where every doctor has their own quirks, different ways of doing things, different protocols, different algorithms. And the idea is to kind of train this health intelligence to learn from the doctor and to replace the doctor when the doctor is not there. So it's 365, 24/7 doctor access in a way. And also, with that, I mentioned genomics, and genomics is going to play a huge part of this. And as a matter of fact, I don't think that any diagnosis or any prescription should be done without consulting first this health intelligence, which is going to include your genome. Because if you think about it, pharmacogenomic test, which is it's analyzing your genome and basically saying you will or will not react to certain drugs. If you look at the stats on the efficiency of drugs, 50% of drugs that we take don't even work. Don't even work at all. And even worse, some of those drugs kill us. We have 250,000 people that die every single year from medical errors. Wrong diagnosis, wrong medication for that diagnosis. Right there, you're dead. And the whole idea with the health intelligence and with this AI and with genomics is to try to save 250,000 lives to begin with. And I think that having a universal system like this that will remove all the heavy burdensome technology that we're using in terms of EMRs and replace it with something that actually is a tool and an instrument for these physicians, we can start to save 250,000 lives. And I think that's a pretty noble cause right there to stop them. So yeah, that's a win if we could do that.
Job well done.
Yeah. And moving on, that was kind of the whole ecosystem and everything that is needed. I'm not saying everything, I'm sure there's something else that'll pop up. But if you have the people involved, the collaboration, the money to fund it, and the way to govern it, I mean, you have a new health economy. And that is the whole idea. So here, these choices kind of break it down into two decisions. And we have the old way of doing things, which we're currently in right now. And if you think about it, it's reactive sick care. Everybody knows that. Up until now, that's all we could do. We've done the best of what we could do. If you get sick, if you have a disease, if you have a heart attack, your foot's getting tingly or something, you go to the doctor, you react to that. And when you react, it's way more money to react. I would much rather be healthy and try to be healthy than go to the doctor and have to have a bypass surgery because I've got some clogged up arteries. So, the whole model that we have set up right now is the reactive sick care model. And it is set up in a way where the pharmaceutical companies want to keep us on the medication. They're not necessarily incentivized to come up with any cures because if they cure us, well, they don't have cash flow anymore. Same thing with insurance companies. Insurance companies, they don't have any major incentive to invest in research and development to find cures for cancer because their turnover is so high the next year that their particular member could get a job somewhere else. Bam, they just wasted money on those people. So they don't really pursue the research and development needed to actually get us to this proactive part of medicine. And they say they're trying to do that, but it's not their business model. Their business model is quarter to quarter. These publicly traded companies, if they don't turn a profit that next quarter, that CEO is not going to get his bonus. So he's not going to drop a whole lot of money in research and development because he knows that's going to be a chunk out of their quarterly earnings or cutting from the revenue. So you have these questions to ask. Do we want to continue with the reactive sick care model, or do you want to be proactive and preventative medicine? And the proactive and preventative way is kind of what I've been talking about with your wearables, with any health and fitness trackers, with your analyzing your genome, with your artificial intelligence. Everybody's got a phone that's got more intelligence in it now than people had 10 years ago with everything. And we're talking about having a global health AI in a few short years. Everybody's going to have access to gigabit internet speeds. We're going to have 4,000 satellites floating up there thanks to Elon Musk. So everybody's going to have a phone and the capabilities to talk to a doctor, to consult with a health intelligence on basic healthcare needs. And there's 140 countries that don't even have any healthcare system, don't even have any basic healthcare services. These people don't understand that if you're having diarrhea and throwing up, that you might need to drink more fluids. There's a lot of deaths just from dehydration. And that's just simple medical education. And if you have a health intelligence to consult with, it could save lives. So kind of going back to the profit over people, like I was saying, we have for-profit corporations that dictate healthcare right now. And it doesn't make too much sense to me if you think about, we give our hard-earned money to for-profit corporations that their business model is set up that they want to take as much money from us as possible and then pay doctors as little as possible. That is their business model. And in between that float, that money they have, they actually invest into real estate, stocks, bonds, and even these stocks they do invest in, they invest into companies tobacco companies and alcohol companies and fast food companies. So these insurance companies are investing in other companies that make us unhealthy. It's capitalism. And in my opinion, capitalism is a great instrument. It has gotten us this far, but I think capitalism and healthcare is starting to erode. I think greed is getting in there. And my previous company saw it firsthand. I don't think greed has a place in healthcare. And I don't necessarily think extreme profit has a place in healthcare. I do think profit has a place. People have to be rewarded for their work, but the way it's currently set up, it's just spiraling out of control, and everybody clearly knows that. So we can either choose profit over people, or we can choose the health of people over the profit. And that's what I keep talking about, it's healthcare for the people, by the people. We choose, our whole style of governance is to put the health of a person first and foremost. If there's an option that either this patient can be healthier, we can spend more money on this patient, or we can make a profit, the answer is always to put the patient's health first and foremost. And kind of what we were talking about, government, insurance making decisions. Do we want to continue down this path? Or do we want to make the decisions ourselves? The patients and the doctors actually get together and make the decisions. Like I showed on the first couple slides there, that we have all the money. The people that have the money have the power. So if we pay all this money in, we can easily say, we're not going to give our money to this for-profit corporations anymore. We're actually going to give it to a co-op style entity like Citizen Health, where we can actually make the decisions, where we can actually get paid for this money we put in here. So this is kind of two things that I want to this is the picture I want to paint, is how bad our current system is and the solution for it, and just, make a decision. And that's like moving forward, this is kind of what I'm going to try to show the American people. And I keep saying the American people, this model actually works better in these underdeveloped countries like I talked about that had no healthcare infrastructure. Because now we're trying to disrupt a $3.6 trillion monolith right now, but you got 140 countries that have no healthcare system in place. So you can instantly go in there and say, hey, here you go. There's a health intelligence. Here's an easy way to manage your finances, to facilitate the healthcare, and even train doctors to do this. So it's wide open, and I think the time right now to do something like this, the time is right now. I mean, you got both sides. You got Republicans saying, oh, we want free market healthcare. We want to give insurance more control. These lobbyists over here keep telling us to do that. And you got the other side saying, we want single-payer health care. We want the government to pay for it. Well, you really don't understand that. That's going to mean more taxes for us, and we're going to pay for it. So you got people want to be cared for. People want health. They want to be healthy. That's what it gets down to. And continuing down our old path is not going to get people there. So we have to do something different, and blowing the current system up and starting fresh is about the only way to do that. So that is the plan. That's the next steps here. We're going to launch with a token pre-sale within the next few weeks. All goes well in the next 8 days. And then we're going to have the main token sale in October, November. Now, I'll just kind of briefly go over what these token sales are. Does anybody know has anybody heard of an ICO or a token sale? Really cool concepts, and people are saying that the #1 app that Ethereum has produced right now is the ability to tokenize parts of your company and sell them in an IPO fashion. You heard of IPO, initial public offering, and that is where corporations sell their equity, shares of their equity. And those are established corporations. Here, with an ICO, these companies, just about a company a day, maybe 2 a day now, are creating ideas, just like this. There's no product yet, just an idea. And these companies are saying, we have 10 million new cryptocurrency tokens that we just made, like the Meta. And they actually sell a percentage of those for a certain price. And it's getting insane. These companies are raising 10, 20, 30, 40 million dollars in a matter of minutes, in a matter of seconds, in fact. Some companies are raising 100 million, 200 million, 250 or 60 million is about the most so far. And that's a matter of a couple weeks. And this is the beauty of this, is there's instant liquidity. So you buy a part of this company, in a sense, SEC, or I don't want to say that, SEC really doesn't need to know that, but you buy a part of this company and you can instantly, relatively instantly, about a month after all the audits happen, you can sell it on an exchange. And that is unprecedented, it never happened before. Previously, I guess I won't go down the whole IPO market idea, but this is an easy way for new companies to initially fund their company and also to create an instant network effect, because you're offering this to everybody, to all of us. And right now we can go and invest with an ICO in the next 24 hours if you want to, if you actually had cryptocurrency. Or you can do that right now without even, you just spend USD and purchase a cryptocurrency. So it's wide open, and it's really revolutionizing a lot of markets, and there will be more and more and bigger ICOs happening in the future. And we're planning a very big one in October, November. So that's where we're at, and I guess I'll open it up for questions now.
So your ICO is currency, but it's tied to a business.
Yeah.
Right? So MIDO is the currency that's tied to Citizens held. So you sell MIDO, but it's backing, it's buying shares of Citizens held. Is that how?
No, it's not buying shares at all. The actual company, this is probably what we're going to do, probably is, create an LLC that actually is just a foundation or something. And it owns, it's not the equity, it's just a cryptocurrency that we generate. For instance, just say, arbitrary number, just say 10 billion coins.
So everyone's encouraged to make it go.
Yeah.
Make it go up.
So yeah, you just basically sell whatever. It's wide open. Every one of these ICOs are kind of different. So I'm going to keep it simple and just say we're going to sell 10% of our outstanding tokens for X amount. You know, whatever that price may be. You might say it's for one Ethereum, which is about $350 right now. You get 350 Medit token. And then you have, of course, you have to have a wallet, a crypto wallet to store those in. And you know, when we put it on an exchange, which typically is about 30 days, because you actually have to get it audited, make sure everything's right, and then once you put it on exchange, you can instantly sell it. And from what I've seen, just about every ICO I participated in, I got about 15 different cryptocurrencies now. Every ICO I've invested in, I could have flipped that as soon as it hit the exchange for 4 times what I paid for it, 3 or 4 times. And I mean, that's unheard of. That's, if you actually want to sit there and just be a day trader and just flip this stuff, then you can make a lot of money. I haven't sold anything. I'm just keeping all these tokens just so I can keep up with the company and kind of watch how the economics play out. And, yeah.
So the success of the currency is based on the success of the company.
Yeah.
The currency was created for.
Yeah.
Is that right? Okay.
Now, I have a question. Is the Medit going to be just a placeholder token for now? Or it's
Yep.
So it's not going to be anything to do with the actual token of value that the users have?
No, the pre-sale will be an IOU token.
Yeah.
And then the main sale, it really depends on what happens between that pre-sale to the main sale if we can actually get a token developed. Because these tokens, they can just be a simple tradable asset, or they can have functions built in where they can be used in the network and the ecosystem, which is the point of the token. It's kind of like almost like a vending machine. You know, you put a quarter in there and you get something out of the vending machine. Kind of the same concept in this ecosystem is if you are a Medit holder, you can participate in the health and wellness marketplace. You can vote on things. You can participate in the incentive network. So it's a pay-to-play type game.
I'm gonna ask a dumb question. Medit, is that an equivalent to Bitcoin? Is that just another brand, or is Medit the type of thing? And does it matter what kind of crypto it is?
It's an ERC20 token. It's a token built off the Ethereum blockchain. So majority of tokens you see right now, it's actually a crypto token built off the Ethereum blockchain. You got Bitcoin and you got Ethereum and you have a whole lot more. But I'm gonna say 90% of all these token sales and ICOs, and token sale ICO, it's the same thing, just a term used interchangeably. They're all basically an Ethereum.
Off Ethereum.
Yeah.
And Bitcoin is not Ethereum, it's a different track. Got it.
And Bitcoin was the original.
So what you just said though, it's not really a placeholder. Then it is going to have value in control of the company or control.
Well, yeah, it depends. I'm talking about initially. Like, there's going to be a placeholder, an IOU token. A lot of these ICOs, these companies are so new and so fresh. They raise the money, and then it takes them a while to actually develop this token because you don't want to develop a token that doesn't have any use case.
Well, yeah.
So a lot of times you get a placeholder token, and then 6 months down the road, you actually exchange that token for the actual token. So
It would be super unintelligent to invest in that because
that's the way all of them are.
I know there's no guarantee that you'll get the
No.
exact deal coded into the
No,
token.
there's no guarantee for any of this. Yeah.
So you got to really do your due diligence and if you trust them or not.
Yeah.
Obviously, DOA is like a really successful case of one that, what are they at, like 200 million now or something like that.
Yeah, well, right now, matter of fact, last month, the amount raised in these ICOs actually overtook the traditional VC funding. So we're talking about if your traditional VC funding atmosphere does not change, the token sales are the way to go. And it's kind of getting out of hand now. If any startup company wants to raise money, they throw together a cheap token and a cheap ICO, and they can raise.
Anymore.
No, they can raise a couple million in a matter of minutes if they want to. Then it comes down to a marketing play. I mean, you got to get your name out there. Google AdWords, Facebook ads, really get the word out there on forums.
What's your play on that? Like, as far obviously it's generalized right now, but do you have any like main channels that you're going to be like, hey, this is my main, because you've obviously dabbled in it for a while, so you know what's worked with other ones.
Yeah, tokenmarket.net is one, and I suggest if anybody wants to look at upcoming ICOs. It's probably the best website that lists out the past and upcoming ICOs. Just list on there. It's free just to list. You can actually pay for ads, and most of all your crypto websites, you can pay to release press releases. I mean, it's kind of, not going to say scammy, but you can pay to have a small little press release that says, sponsored post down there. But yeah, it's wide open. So probably for one, token market, Bitcoin talk, Reddit is number one. I'm not big on Reddit, so that's going to be different for me. Twitter's big. Facebook, Google AdWords, all the above.
Yeah, so you just got to measure obviously what cap is going to be best for.
Yeah, and it's really who you're trying to target too, because a lot of these ICOs, they're trying to target the tech guys, the actual developers. And majority, or not saying majority, but a lot of these, this is global. This is not just American. This is global. Anybody can invest in this, and it really
doesn't really have a whole lot to do with citizens health. That's
what ICO.
Yeah.
No, ICO doesn't for everybody. And that's
okay.
That is.
They're not going to look at your company and the plan for.
Oh, they will. Yeah.
Or they will.
Well, that's the thing. Like, you have to have a viable, good-looking website, a white paper. A lot of people want to throw out a white paper, pretty much describing everything that's going to go on, just in detail. A good video, a team member section that actually lists out your team members.
Just like crowdsourcing on any of the
Kickstarter.
This is like
crowdfunding.
Kickstarter, but
like
instead of
Kickstarter.
getting a shirt or a sticker, you're actually getting a token that you can sell, and it can go up in value.
I've got a question there. If this is going to be worldwide, what's their incentive to join if it's only going to launch initially in the US, or is it going to launch worldwide all at once? Are you going to have different pools?
99.9% of these guys investing in these token sales are there to flip this currency. I mean, that is the main reason they invest. They invest
But
in
you get cash.
Yeah, oh yeah.
To launch your business.
See what it is, I mean, we could probably easily raise a couple $1 million, and that's in Ethereum. That's going to be in Ethereum. People don't, well, it depends on how you set up the token sale, but I'm going to do it just in Ethereum, where people just send you Ethereum to your smart contract. And the smart contract is coded in a way where you actually get this Ethereum and you have a log of their address. And when the time is right for you to release the tokens, you just release the tokens based on the amount of Ether they sent on those addresses. So it's all automatic. And trying to get off topic there. We'll just address that question.
How other people from other.
Oh yeah, it's mainly to flip it. I mean,
That's
unfortunately, you're gonna have a lot of people flip it. You're gonna have a small percentage like me that actually see promise in the company and want to hold it for long term. Because this is the equivalent of me coming to you in the 90s and saying, hey, there's this new company called Google and Facebook and Amazon and Apple about to come out. You might want to put a couple $100 in this, because 5 years time it could be something huge.
So real quick on, you're talking about marketing, all that type of stuff. With, you listed 5 main core components, the incentive engine, collaboration engine, health fund, all those right there. Have you, and you've spent a lot of time on this, and those are the, I mean, with this you just did a brief conceptual overview. Have you spent a lot of time already wireframing all those together on how the software would interact and work, or is it more just conceptual on the types of things you want it to be?
Conceptual right now. I've been lucky enough where I spent literally since January 1st researching this stuff about 12 to 16 hours a day. I mean, every waking hour I've been researching, just really researching to see if this was possible. Because I don't want to come across any roadblocks like, oh crap, spend a lot of money and time on this and it's not possible. Finally got to the point where, okay, this is possible. And I researched every single touch point in healthcare. It took me a while. But finally got to the point where I realized this is possible, and now it's time to do it. So the whole idea is to kind of open it up for open source innovation, saying this is the idea, does anybody want to help? And if people want to come help, we start designing things. There's a lot of open source collaboration tools that we can do this with. So I've thought about the incentive system and working with Human API. They have about 40 or 50 different data points. You can instantly connect with the top 5 EMRs and import all that data in there, just about every single consumer wearable. So that's going to be huge. And we can just instantly connect all that.
Yeah, even with like EMRs, so you talk, some of that is a night and day switch, because there's a lot of purpose. I've helped write some EMRs and other things like that, besides the regulation crap that you have to go through, just in the functions that a doctor does to come into a patient that's his 32nd patient today. What did I do last time? So the other functions of an EMR like that are still viable. Is there and then all of this is viable, so there's some things to think through on how to transition, how to tie into an existing EMR, maybe eventually get rid of the EMR, but not cold turkey and say, look, just go EMR free. It does a lot of other things.
Your Alexis tracker.
It's never going to disappear. It'll evolve. It's not.
It's going to evolve. I mean, EMR definitely serves a purpose. I mean, you're having a record of health, and it's not just your record, your patient, your health records. It's actually the physician's notes on you too. So it serves a purpose. But a large percentage of the EMR is actually built for insurance, billing insurance. And the whole idea here, with direct primary care, these guys, they're adopting brand new EMRs, or they're not even calling them EMRs. It's just new software. It's like it turns into a CRM then, because your patient turns into your client. So Atlas MD, if you want to look at that, they actually have Atlas.MD. They are the best EMR out there for direct primary care. And there's multiple ones popping up now. But it's a completely different business model, because when you remove the need for insurance, all your CPT codes and all those codes, you kind of free up the possibility of using technology to help you. And that is what the idea of this health intelligence and whatever we try to call it, we're actually going to bring physicians on board and be like, all right, what do you want? Yeah. Let's build it.
And at the end of the goal is to make that doctor's experience even just at the max possibility with what AI and everything else can do, so that it really serves him the best. And optimally, he's looking at the patient and talking to them. I have some docs that I've written full on EMRs, and they say, look, no offense, I don't like to. When I go in, I'm eyeballs to eyeballs. I'm only 6 minutes in that room with the patient. So he has a scribe or someone else doing all the EMR entry, but he wants eyeball to eyeball, so that that patient doesn't think, I spent all this money so you can stare at a computer screen. And
that's,
I get it. I totally agree. But we got to get to point A to point B.
That's what the good part of this direct primary care movement is. These doctors are completely dropping insurance. So they're completely dropping their old EMRs, and now they're looking for new solutions. So they're adopting newer technologies right now. I mean, you literally have direct primary care doctors building their own EMRs.
Well, and they moved from paper, which they loved and charged, to EMR, which is better because it's introducing all the electronic capabilities. But they did it because there was first a carrot, and now there's a stick with just the penalties, with just the government stuff. So that's good that they made the switch, but now it's time to make it even better and let them get away from all that.
I mean, you think about it, how many doctors still fax? You got an idea, a lot of them still fax. I mean, it's ridiculous that doctors still fax. Matter of fact, what was that? I got a bunch of labs done at Forest General the other day, and my doctor from Wayne Hughes, he actually had to fax over the prescription or the order for that. And I had to sit there and wait. I was at Forest General, she's like, we hadn't got the fax yet. And then it called back, there's 2 phone calls back and forth to figure out how to get the fax right. It's like, y'all, seriously, it's 2017, we're dealing with faxes right now?
Yeah.
I mean, there's so much outdated technology, and you look at the newer doctors that are graduating right now, they grew up with the consumer technology. They grew up with Facebook and good UX and good UI. And now they're being plopped in to deal with the burdensome the EMRs we got now, and they realize that this is terrible. Like, I got to deal with this. So that's kind of what the idea is, to take these newer doctors that are familiar with newer technology and just bring them right into something new right off the bat.
They definitely hate the regulations that are driving they hate that. So this is a way to fight back.
Yeah.
That's definitely a positive.
One question, comment, like devil's advocate, I get it, I love it. So, and this may be more Mississippi specific. So this looks a lot like private school versus public school, with folks who can pay for healthcare who are not reliant on the government funding. Tell me what your concept is on that. And in Mississippi, that divide is even wider than, say, the rest of the country, with a lot of Medicare, Medicaid.
Yeah. If you think about it, I want this to be 100% universal healthcare. Everything is covered. It's not going to be any procedure you want that's covered. It's the essential things that are covered. And not only are we going to pay for what's covered, like what you need, we're actually going to figure out exactly what you need. So there will be second opinions thrown in here. You're not just going to have one doctor saying, oh, you need to get your leg operated on. No, we're going to get second opinions to make sure that's actually right. There's so many unnecessary procedures done. But to answer your question, we already pay enough. Just half of Americans pay enough, twice as much, to actually cover every single procedure for everybody. Medicaid, Medicare, Indian Health Services, everybody. So we have the money. We're already paying enough. So we can cut our premiums in half and still cover everybody if we remove the intermediaries. And with blockchain technology, with smart contracts, I mean, I'm looking at captive insurances, and this is a concept we're doing with employers. And I'm thinking about it, like one single smart contract can eliminate a captive insurance company completely for essentially free. And I mean, that's going to change a lot of things, the actual implementation of smart contracts. It's fairly new too. So, I mean, we're all talking about it a couple years down the road. This is not going to happen next month. And this is my 30-year plan. There's a 10-year plan, 20-year plan. It's going to take a while for this technology to get there. Like artificial intelligence, you know, it's not there yet, but the next couple years, we're going to make a whole lot of progress. And especially, you know, 30 years from now, we might have Skynet. We might not even be here. So, but the technology is progressing so fast, and yeah, the exponential technology is about to converge, and your exponential technology, and that's where it's like doubling every single year or whatever that time period may be. So we're getting to that point where it's starting to go straight up. You know, we're starting to have a lot of progression in all this technology, and it's coming together too. So yeah, to get to your point too, I'm thinking about subsidizing this based off the incentive engine. So you're generating Meadow for living a healthy life, and it's not just living a healthy life, it's doing things for other people. And we're talking about your friend might need a ride to the doctor's office, your friend might need incentive to go to the gym, your friend might need a friend, something, just hang out with somebody. And there's going to be a lot of metrics that are built in to pay people. And getting further on down the line, AI and robotics is going to replace a lot of jobs. So there will be a need, I don't know how people feel about this, of a universal basic income. And that's just inevitable. People are going to lose jobs, you got to pay them. And I want this to be set up for that when the time comes in probably 15 to 20 years. So, yeah. So, anybody else have any questions?
So there's going to be a set amount of Meadow, let's just say, in the beginning, that you're going to give out certain percentages, you open up certain percentages up to buy, and it can't be a locked amount forever, obviously, because you're talking about generated Meadow.
Yeah.
So you're going to have to unlock it.
Mm-hmm.
How are you going to bring more money in? Like, say people pay monthly, where does that money go? How do you take it in? What pool does it go into? Does it get transferred to crypto? If it does, how do you spend it out from there? And then on top of that, what if 1 year there's a plague and you have to go over your amount that you take in, you're that half of current premiums that everyone's paying, whatever?
Well, on that, healthcare sharing ministries, kind of that movement now, that is huge right now. As a matter of fact, I had 2 people back-to-back days last week tell me, man, have you heard about healthcare sharing ministries like MediShare? I'm joining that. That's basically people, it's kind of limited to the Christian faith now, where people essentially just pool their money together and pay out claims from that pool. No insurance regulation, straight up, that's what it is. So in a sense, this is what this is. We just put a lot of money in a pool. If something happens, we pay it out. But you made a good point there. When people pay monthly premiums, that is going to be converted into cryptocurrency. So where does that cryptocurrency come from? Well, part of the token sale will be, I've already figured out 30% of the outstanding tokens will be used for that. When people do convert their USD into cryptocurrency, into Meadow, it will be coming from that 30% pool. And that will probably be used up in the course of 10 years. And that's the way a lot of companies are doing it now, is they have like a 10-year period, like Bitcoin. All the Bitcoin will be mined by, 2140 or something? Yeah. Kind of the same concept. You're going to have some coins, some Meadow sitting over here that every month when you do convert that fiat into Meadow, that Meadow will come from this pool. So that's kind of the idea behind that. So you have to have a large enough pool to make sure that works.
I mean, you'll have to, you're going to have to make money off of this for the institution, right, to refill the coffers. Because every time any event happens, you'll have to pay out of the pool. You have to take a net income, right, in Medit. You see what I'm saying? Like, you have to make money.
We're making the money. We're a Federal Reserve bank. That's essentially what this is. You generate money, and you keep 10, 20, 30% for the company.
Yeah. And
whenever you want to profit, you sell some of that. But also, you can charge a transaction fee. When we're talking about $1.2 trillion, yeah, charge a 1% transaction fee, whatever, and still make money. And there's plenty. We're talking about a couple $1 billion just to operate. That's fine. But to your point there, when somebody does, and that's a good question, when somebody says, here's my bank account number, I'm going to send my money instead of this corporation, I'm going to send it to Citizen Health, that USD, how does that get converted? And that is we're going to have to turn this into an exchange. We have to create an exchange where you can take that cash and exchange it with Meta. And then you have all that cash. What the heck do you do with all that cash? $1 trillion in cash. I don't know. It's a question left to answer.
Have you thought about what kind of protections you're going to have in there for if there's volatility in the coin? Because there will be, presumably. And,
Oh yeah.
you know,
Well, the whole idea here is if think about it, if you're purchasing more coin every single month or day, or I mean, I don't know if this will be a set day. The whole idea, I mean, in my mind, it seems like this kind of would continue to rise and rise for a while. Now, I don't know. That's just the market. So that's really all depending on the market.
all it takes is one scare. You know, I mean, all cryptocurrency right now, and historically, all cryptocurrency ever has been extremely volatile, right? So what do? What kind of protections are you going to have? Because people's livelihood have to be, you know, paid out based on this. I mean, you have to pay to fix
Oh,
something.
that's what I was getting at with the healthcare sharing ministries. When you join that, you actually join under a caveat saying, if we run out of money, we run out of money.
And you're just
done. I mean, that's part of people joining it.
So that would be part of
Oh,
this,
yeah.
presumably.
Yeah. And well, there's other options too. I mean, just like having, what's it called? Having a backup insurance plan. You know what I'm saying?
Catastrophic.
No, it's insurance companies have insurance companies insure them. I'm drawing a blank here.
I kind of know what you're saying.
Yeah, all your insurance companies, they have an insurance policy on themselves. Just in case they go bankrupt, they can actually pay back in a situation like
It's
this.
ironic because that's true insurance, whereas current healthcare-based insurance companies aren't really insurance, are they?
No,
They're healthcare
many
payers.
investment banks.
Is there going to be a limit on how much Meadow is let out on like a per day basis? Or I'm just not super familiar with that. Or is it going to be like, hey, there's like, obviously people are with the incentive structure of people doing, you know, good things that are they're being healthy, they'll be getting fed that because of that. But is there going to be like a limit on it of if everybody's just being healthy, going crazy, is there going to be like, okay, there's a cap or they're fighting to be the most fit to get more Meadow or maybe?
Well, there's
There's a lot of
I don't know yet. I mean, I thought about that. And here's a lot of these companies. They don't have just a set amount of Meta or a set amount of their token.
Yeah.
They actually are introducing inflation in a way in this economy where every 18 months they generate 10% more coins.
Yeah.
That's the way Steam it is. Steam. They actually they have inflation set up in their economic schedule, and people are okay with that. Inflation happens in every monetary system. So, I mean, it's just really got to weigh it out, figure it out. I mean, you have to sit there and do the math.
And also subscription-wise, obviously, as it's getting bigger and bigger, of like, how is it going to be priced with like, hey, is 70-year-old Susie going to be paying the same as 23-year-old Rick who's in phenomenal shape? Or there's going to be obviously a big spectrum.
Oh yeah, I mean, there's a lot of things to work out.
Yeah.
A lot of things to work out, and I'm not going to be solving that. It's
You
not
got
gonna
the citizen stuff, and then you got the funding mechanism. I mean, it's like it's two different, very large projects.
Citizen health is more like
Connected,
just an
but also
economic
not.
theory in a way. It's really just kind of a theory on a new health ecosystem, and this ecosystem that we're developing is is generated to fix healthcare, to replace all your broken parts of healthcare. And it's innovative. I mean, this is completely brand new, and I mean, it could fall flat on its face. I don't know, but nobody's trying to do something big, and this is something big, and I think it's something needed.
So there's not a lot of, independent physicians are just way down. Everybody's joining groups and big clinics, and Hattiesburg Clinic is growing by leaps and bounds, but there are less and less independent private physicians in any specialty or family practice.
You know why?
Do they come out, or
Yeah.
do med students come in and offer
Both.
Both.
Okay. A lot of physicians are retiring because they're so sick and tired of dealing with regulation. I mean, they'll straight up say that number one cause of physician burnout is dealing with EMRs. As a matter of fact, I did some math, and if you look at, on average, a physician spends half his day on the computer, just checking boxes and stuff. Okay, let's just say 2 hours a day to keep it simple. If you look at 900,000 active physicians, 2 hours a day, effectively, we're removing the treating power of over 800 doctors a day by letting them, spend a lot of time on the EMR. But that's over 300,000 effective doctor hours or doctors in the course of a year.
But I should say, I've spoken to several doctors, and they've all got the same conclusion. It's not the EMR necessarily that's the problem. They love that they can put something in there that's searchable and everything
Yeah.
else. It's the mechanism for entry. They would love to have scribe do it. Regulation says that they can't do that for like Medicare or whatever.
They have to put it in personally.
Yeah, they have to personally put it in. That's where the disconnect is now. Regulation is strangling it. It's not the EMR.
Yeah. That's why.
But the EMR was created out of regulation, or at least a lot of the bones of
That
it.
is with direct primary care, it's coming out from underneath that regulation. So it's wide open. You can do whatever you want to. You can build your EMR however you want to. You don't have to sit there and document every single thing. You don't have to document anything if you want.
I shouldn't say, yeah, I didn't mean that current EMRs are perfect. I just meant that the concept of the EMR is perfect. It's what the doctor needs. It's just that the current implementations are because of regulation.
Oh yeah, I mean, 20 or 30% of the EMR is perfect. I mean, the doctor gets to take notes, you know, gets to see the history, all the medication history and surgery history of the patient. But
So this clinic, this building right here, to the east of us,
yeah,
with the new plant, nice little right next door to Develop. That's 50 to 60 people that just manage Epic for Hattiesburg Clinic.
Oh, it's crazy.
Oh,
yeah.
really?
Like 60 people.
That sounds about right.
Wow.
That are literally hired solely to manage the
Wow.
EMR
Yeah,
platform.
let me see.
And what
Remember
are they managing? They shouldn't have
that,
to
all that
manage
yellow
it.
stuff? That's what that is. Entirely what that
No,
is.
it's training, it's computer programming, it's cyber security, it's password support.
And it's all built to facilitate health
That
insurance
entire
companies.
space.
You remove health insurance companies,
It's so
and you remove the need for all of
The
that.
entire point of software is to make you work
Yeah.
more efficiently and
To use it as a
do the
tool.
opposite,
Yeah. So this is,
that's almost as bad as paper.
but to answer your question, you got the old doctors who are just tired and fed up with this. And a lot of those guys are the ones moving to direct primary care. They're like, oh, what? I don't have to deal with insurance. I can just sit there and kind of take on a 600 patient caseload or patient load versus 2,000 patients. And the old doctors are loving it. Now the younger doctors are the same way. Matter of fact, I don't know if you remember Dan. You remember talking to Dan? Dan Lynch, he's a physician. He's working on this project with me. And he kind of chose to stop stop his residency program in a way because he was so fed up with health insurance, just with dealing with the regulation. He took some time off. Now he's back into Missouri now, going back into his residency program up there. But the newer doctors are more fed up than the older doctors because they realize that this sucks. I'm trying to get into medicine and actually treat a patient, not to deal 3 or 4 hours a day with this crappy software.
And this is disproportionate because direct primary care doctors normally avoid Medicare or anything like that, right? They just want to take cash in. The
Yeah.
people that can afford that are on Medicare. So those are the highest, the highest cost patients for everybody. We're all paying for that, and they can't even be treated by these better doctors because of the way the regulations set up. Not run the best doctors out.
I know.
It's crazy.
Kind of the whole concept too, when we start talking about trillions of dollars, 1.2 trillion just in premiums, you can do a lot with that. And that health fund that I was talking about, I got an idea of basically paying down the loans, the student loans for all these doctors. 'Cause every doctor, they're going to graduate with about $200,000 in student loans. The whole idea is to hire those doctors. Oh yeah, definitely. They hire those doctors and instantly say, okay, come join Citizen Health, be our first initial doctor load, and we'll repay all your student loans. No questions asked. Just join us. That's the concept.
So then it's got to be at the point where you have enough patients for them to have the incentive to be like, hey, you
Oh,
got
yeah.
400 or 600. Okay, I'm confident in knowing that there's going to be the network there.
I mean, it's chicken and the egg thing, but I'm going straight after the direct primary care patients already.
Yeah.
Because you have 10,000 doctors out there. Each one of them has 500 to 700 patients. I mean, the patients are out there. People hate dealing with insurance. Heck, I hate dealing with insurance. Everybody else does too. I mean, think about it. Your
It's easy to
premium,
sell.
yeah, it's easy to sell. Easy to sell. People just got to understand it. You start throwing out the word cryptocurrencies and hashes and blockchain, they're like, what? I was talking to Scott Adams, the creator of Dilbert Comics, and I was talking to him about this, and he said, I tried to explain it to him, he said, I equate blockchain and healthcare to a ball of yarn. He's like, I completely don't understand what you just said. He said, you've got to simplify that, so I'm trying to simplify it.
But for the average consumer, it's just, you just gotta explain direct pay.
Yeah, yeah. And the thing is, they
Because
knew.
they're not gonna pay you, they're gonna pay in cash,
Yeah.
or payroll deduction, or whatever.
Yeah, yeah. They don't know. They want health. They want to go to the doctor whenever they want to go to the doctor whenever they get sick, and they want their pharmaceuticals to be covered. If it saves them 20% a month, and that's actually the plan, is saying, hey, everybody, bring your last statement, your last premium statement, and we're instantly going to cut it by 20%. No questions asked. You got to generate a patient load, member load somehow. So People are fed up and they're ready for a change, and there's no good alternative, and everybody knows that.
Well, if 90 or 80% of people, or whatever the statistic was, of people can get away with just going in and paying a la carte, how are you going to compete against that? Because you need more people to overpay slightly for what they get in order to keep this pool viable, right? To cover the people that otherwise can't afford, because you will have outliers that are much more expensive in your pool.
Well, it's kind of something we're talking about, the subscription-based model. If you just go straight for employers and get them to sign up, I mean, the money we already pay is twice as much as what we need to cover everybody. Everybody.
Yeah, but that's what I'm saying there. If the majority of people can just get away with a la carte options, which will pop up, they're going to pop up as we go. DPC is getting way more popular, and just direct pay in general. If they do that, how are you going to compete with that? Because it's the same things what you need, and you don't have to. They don't have to. What am I trying to say? I guess you need a majority of people to be on this platform. You need healthy people that will be slightly overpaying for their healthcare in order for this to work. How do you move them? How do you keep?
It's not. The initial thing is $75 a month.
Yeah.
And then there's a la carte stuff on top of it.
The bigger picture is to have every single American on this 325. I mean, these single payer, everybody is on this. That works out best. We actually work with the government, getting the Medicare recipients, the Medicaid, and all their government programs.
So the government's paying their monthly fees.
Oh yeah. So the idea is this will essentially be a plug-and-play economic model for health. You go to countries that don't have a healthcare system, you're like, hey, we got something set up. Just take your tax revenue and let it go.
Yeah, this will never be mandated though. It'll always be optional. You'll never reach 100% adoption unless you.
You can never say that until it happens.
Well, until you the
Until you
odds.
do it.
I guess I'm saying the odds are very, very low that would ever happen.
Not really. The odds are pretty high. If you think about it, the government wants to save money. If you show them a way to save money, they're all over it. If you show the American people how to save money, they're all over it. It's pretty easy. The insurance companies actually have not built up any barrier for the switching costs. Think about it. You pay $1.2 trillion to for-profit corporations just out of your bank account. All people have to do is say, yeah, we're going to change that draft to this company. In one day, we can shift $1.2 trillion. Simple as that. Of course, the banks will definitely shut down when that happens. But it's easy. I mean, you say it's impossible, but no, it's actually very easy.
Well, no, I guess what I'm saying is the government will, especially in this current political climate, will want to foster multiple options. People will want to have an option for what they want to do for their health care. And like I said, if you can get away with paying less,
Well, where are you doing that at?
Do what?
Where are you doing that at? There's no place to do that. This is that option. There is no other option.
You just told us how explosive the growth was in the DPC market.
Yeah, exactly. That's what we're riding on. There's maybe 10,000 doctors. You've got 900,000 doctors. I mean, you're talking about a speck in that. And they're all fragmented. There's no network of DPC doctors. Everybody is doing their own thing. I should say there's no network. They have like franchise models that have probably like 20 or 30 doctors at max in each company. But some of them actually went out of business recently.
I'm very surprised that Doctors on Demand hasn't gone to something like that. They have the clout, they have the recognition, they have the money behind them. They can make the
Who's
jump.
to say they're not? I
They
don't know.
could, yeah. They might have something in the works.
But the idea is all these fragmented doctors that are wanting to practice DPC is to invite them to a network where they can participate in this health and wellness marketplace, where they are instantly opened up to a huge network of patients. And that's the idea, is to create a network of these direct pay doctors. So I mean, it's turned into a marketing play then. It's got to be beneficial for them and everybody involved.
How do you choose, like, let's say you want to get a procedure done you want a knee, or replacement knee, or replacement hip. There are multiple models available on the market, but within your platform, you go for what is the best for the price and all the metrics you feed in, based on the community's decision, right? In some manner, whether it's the doctor community or whoever. What if they don't want that? They just would have to pay for the procedure on their own to get a different option, right?
Well, I mean, you could, any way you want to create it, you can have, okay, this is the best option possible. Cost the most. I mean, there could be out of pocket costs too. If you want to pay more,
At some
then
point,
it shouldn't
you
be.
will flag something that is flagged as the best option that will not be the best option. I mean, that's just, yeah, I mean, it will happen. It will always happen. It's inevitable. You can't be 100% accurate on which one is the best.
I mean, we can 99% accurate. I mean, doesn't really matter. I mean, the whole idea is to offer the best solution possible that we can possibly come up with.
So I guess my question was, what will be their options at that point? Will you cut partial pay if they want to go and get a different option, or you?
Yeah, it's open for interpretation, whatever you want to create. Now, I do think just like that, I've never thought about that. So I mean, there's so many things that I've never thought about that it's going to take people just like that, comments like that, questions like that to construct the whole model. And that's part of the whole open source initiative.
How will you decide what's covered and what's not? I know you say by smart contract, but someone has to make the choice to put into the smart contract that this has been completed, right?
That's part of that community governance layer where essentially we're saying the idea is to replace AMA. And that's what kind of the American Medical Association does. Is they say they get a group of 20 or 30 doctors in a closed room that own multiple surgery centers, and they say, okay, we want insurance to pay this for this procedure. So the idea is to replace those guys with an open source transparent model of kind of going down the same list of there's like just every single procedure. Literally, it's going to be
could be monetized. Yeah, I mean, you can put a value on it. I agree with that. That's doable. That's incredibly difficult, but it's relatively easy compared to what I'm talking about, which is the layer where you input into the software that so-and-so procedure was done and it hit these marks and it is covered.
Yeah.
Or you see what I'm saying? Like
yeah,
there's
I know exactly what you're saying.
some ambiguity in text. Like how do you translate that to a person has to make that? That's where some of the administration costs of hospitals goes.
Well, the whole idea is to initially have this initial period where people sit down at the table, patients sit down at the table, employers sit down, physicians sit down at the table, and we all say, okay, let's spend the next 60 days and just go down the list of look at every single procedure and say, all right, as a patient community, we want to pay this, and we want this package price. And the physician community says, yeah, we want to pay, we will do it for this price, and you just meet in the middle, and it's a negotiation. I mean, think about it now. Physicians really don't need to negotiate too much. They just get forced of, all right, this is a screwed up system, but they just say, we're going to bill twice as much for this and we'll accept whatever they want to pay us. So the whole idea is to really reach a consensus between the doctors and the patients.
So what ability will the doctors in the group have to override your AI eventually when that's a thing? Because the doctor's the one's going to make the call that says, oh, this will be covered, right? Because the doctor says this meets those criteria. This
we'll see. I don't think it needs to be just one person make that call. There's what is the name of that company? I was talking to some DPC doctor the other day, and he was telling me, that was Warren. Anyways, he was telling me about this one company this is a employee benefits consultant. He was telling me that there's this one company, they use a software that every one of their employees, when they get a procedure done, it is not it's not set in stone. They do not believe that doctor and take that doctor for his word. There's a service that offers crowdsourced opinions from other doctors saying, no, that patient does not need that knee surgery. He just needs physical therapy, or he just needs to get some different shoes. Whereas the doctor that's saying, I want to cut on you, he wants to make money. So you have kind of open up the crowdsourced model for whether or not that procedure is even
diagnosis.
Yeah.
Have you decided any further on how you're going to pay the doctor? How are you going to decide salaries? Are you going to be based on the reputation points? Some doctors do more at-risk surgeries, so they're going to have a much lower success rate anyway, period.
I mean, if you look at, the whole idea is to score your doctors. Some doctors are going to say, I don't want to do that. Well, they're bad doctors. The good doctors are going to say, you can definitely score me and get my outcomes.
Well, like some doctors intentionally go for lost cause cases, though, and some are crisis doctors, some are, investigative doctors, whatever,
Well, we're only talking about a small percentage there. I mean, most of your specialists is cut and dry, Come in here and we operate on you for an hour, we do this 5 times a day, you're out the door, complications.
Well, if you're going to take like 30 to 70% of the market, that makes sense, but if you're going to go 100% of the market, you have to cover those weird edge case doctors too, right?
Yeah, I mean, there's going to be edge cases.
Okay.
When that comes up, we'll try to anticipate it and plan accordingly. I mean, all these questions, there's probably 1,000 times that.
Your million questions.
Yeah, I mean, we're talking about a huge monolith industry that is so broken right now, that has so many touch points that there's going to be so many discussions to fix this. But its first step is just removing insurance and creating a new financial instrument to fund this. That's the idea. And it's a big and a bold plan, and it's dangerous. And I always tell people, I'm worried about the insurance companies coming to kill me. They straight up think about it. I mean, this is essentially going to these huge corporations that have been around for 100 plus years and saying, yeah, you had a great run, but your business model's broken, and we're gonna cull it, and we're gonna start over. And that's what we're saying. That's a bold claim. That's kind of scary when you think about it. But it's needed. It's worth it. I mean, to get humanity to where we need to go in the next 30 or 40 years, we need to implement something like this now. Because if you think about it, our politicians, they're planning to get reelected the next election cycle. So they're going to definitely push forward whatever's going to get them elected. That's all they care about. Same thing with corporations. They're going to do whatever makes them the most profit the next quarter. It's a messed up system. And the whole idea is to take the reins from those guys and put it in our hands so we can actually control it. That's the idea. Anybody else? Thank y'all for listening to me. That's awesome.
All right, y'all. We are all done for the evening. Try not to get stormed though. Sounds pretty good out there. And don't forget to check the website for next month's presentation. He's a pretty big day.
It's like
A little better.
$99 a year.
Sure.
And it
A
covers,
little bit. Thank you. Appreciate it.
it covers,
Yeah, if I just hit that red button.
you don't have